An estimated 4% of the population experience severe mental health problems, such as psychosis and bipolar disorder, which can have a big impact on their lives and the lives of their family and friends. Psychosis is an umbrella term which describes several different conditions in which people experience things that others would generally think are not real. For example, hearing voices when there's no one there, or believing things that cannot really be true. The term bipolar disorder describes episodes of extreme low mood, depression, an extreme high or irritable mood, mania or hypermania. Some people get support through local health and social services, but the vast amount of support comes from their relatives and friends. This support saves the NHS a lot of money, and without it, the NHS wouldn't be able to cope. However, giving this support comes at huge personal cost. Relatives often struggle to make sense of the changes that are happening within their family. Here are some of the common concerns that relatives and friends have. Is this happening because of something I've done or not done? Am I to blame? I don't know how to respond when someone I care for acts in bizarre ways or talks about their strange thoughts. I want to know how to look after them and keep them safe, but what if they harm themselves or are having thoughts about suicide? What should I do? How do I balance supporting them with other family and work commitments? I'm worried that it's affecting my relationship with the rest of my family. I don't know who to contact. The staff have different job titles that don't make sense to me. It's important not to forget that caring for someone with a mental health problem can also have many positive aspects to it. This journey can bring people closer together. It can offer an opportunity to spend more time together, learn more about each other, and show their love and compassion. There is good evidence that by supporting relatives, we can improve outcomes for them and for the person experiencing mental health problems. The National Institute for Health and Care Excellence, NICE, recommends that all relatives of people with psychosis or bipolar disorder need easily accessible, up-to-date information. Specific guidance on how to respond to challenges that come up when supporting someone with a mental health problem. Emotional support, particularly during periods of crisis. The chance for relatives to talk to each other and share their learning and offer support to each other. Directing to lots of other sources of information that might be useful. To help services to deliver this kind of support to relatives, we got together a team of clinicians, researchers and relatives and developed a relatives education and coping toolkit called REACT for short. REACT is a website that has lots of relevant information to support relatives. It includes 12 modules, all addressing key issues that relatives face. There's easy-to-read text and videos of people sharing their own experiences. There's a forum where relatives can talk to each other and get support and ideas from other relatives. This is a safe space that's monitored by trained REACT supporters who also have lived experience of supporting a relative or friend through mental health difficulties. Relatives can also send direct messages to the REACT supporters about things they'd rather keep confidential. REACT also includes an extensive resource directory that signposts relatives to other services and support across the UK that they might find helpful.